I'm Janine Charles, and this is Deegan Charles. Deegan is 4 months old. We all have our expectations of what having a baby is going to be like. And so when you find out that baby's coming early, it's kind of scary, particularly because you have a primary caregiver throughout your pregnancy, and then suddenly you have all these new faces and all these worst case scenarios thrown at you. And then all of a sudden the baby comes, and for some parents, I think it's quite traumatic. For me, it was, he was perfectly healthy. He was just early. So he was on CPAP and stuff a little bit because I think he got some fluid when he was born, but otherwise he was just small and just ahead of his time. I think the hardest part in having a premature baby for our family was when we were discharged. It was like pack up your stuff and go home and leave your baby behind. And I think for most premature babies and the mums, that's probably the hardest part, is when you leave the hospital and you go home, and it's like you expect to go home with your baby and your flowers and all the things that, and you get home and it's pretty much nothing's changed, but everything has changed. My experience in having a premature baby was, it was not at all what I expected having a baby to be like. I don't think that it's fair to the baby to kind of, as a parent, be hands off and let the healthcare staff take over. You're doing kind of an injustice to the child, and you're doing kind of an injustice to yourself, because you're basically saying, well, I'll just wing it when I get home. If you're able to work side by side with your healthcare team and kind of be there step by step through the process, then I think it makes it a lot less scary going home. And you also feel a lot less isolated. So, you kind of end up feeling like an observer in this whole role if you're not actively participating. I think it happens because, it's easier to kind of sit back and let the healthcare team kind of do those things for you. But long term, I think it's better for everybody if the parents are more hands-on. I certainly felt like it was an easy transition going from the hospital to going home. And I also think it made the whole process a lot less scary when I knew that if the monitor started beeping, what those numbers meant, what was to be expected. Sitting there when they would do their rounds and hearing what the healthcare plan was for Deegan was so important, because I knew that, my expectations may have been this, but their expectations were that. So he was actually doing much better than, say, I had expected, because I didn't know what was going on.
Hi, my name is Benzies. I'm a full professor in the Faculty of Nursing at the University of Calgary. I am a clinical research professor in the Department of Pediatrics and a full member of the Alberta Children's Hospital Research Institute. Family integrated care means that we are thoughtfully and planfully bringing families into the care of their infants from the time the baby is admitted to a level 2 neonatal intensive care unit to the time that the infant is discharged with the family. We know the science of early brain and biological development speaks to the idea that early parent-child relationships are critically important to the child's development. So that's one piece. The other piece is that when a baby is born too soon or premature, that it's often difficult for parents to gain the kind of confidence and competence that they need to take the baby home, to feel comfortable caring for that baby at home. So think of a baby born too soon. Maybe the nursery is not ready. You weren't expecting this baby. It's stressful for families, even families who are having a full-term baby. The families will begin slowly with the support, education, and guidance of the nurses. They will learn to do more things for babies. Often babies who are born premature are kept in incubators or isolettes to keep them warm. So nurses will help the parent to become comfortable to change a diaper, will be comfortable to bathe the baby. But this will be in so-called baby steps, and it will change. So when the baby's first born, and as soon as the parent is able, the nurse will begin to orientate the parent to the baby's needs, to basic hand hygiene in the nursery, to what it means to have a baby born too soon. And then as the parent becomes more comfortable, gains knowledge, then how to lift the baby carefully out of the isolette with all of the tubes and wires attached, and how to do that safely, because we know that skin-to-skin contact between the mother and the baby, or the dad and the baby, is really important to their development. So by the time then that the baby goes home, the mom and the dad will be comfortable, confident, competent to give the vitamin D medications that they need, to bath the baby, to provide the care, to recognize signs in the baby that they need to call out for medical assistance.
My name is Dr. Abhay Lodha. I'm the Associate Professor at the Department of Pediatrics and in the Community Health Sciences at the University of Calgary, and I'm a member of Alberta Children's Hospital Research Institute. The results of our study will change the healthcare provided to neonates or premature infants, especially 32 to 34 plus 6 weeks gestational age, not only in Canada but it's all over the world. Because right now, as I said initially, the babies are always staying in ICU and the parents are not involved in the care. But if our results are positive and our study if shows that if there is a decreased length of stay and the better neonatal outcome, that will not only improve the outcome and better outcome for the parents and babies, but also will have a less economical expense or healthcare cost on the healthcare system.